is the Health Senior Human Services Youth Education Human Rights meeting, for, October. And, so we have a long agenda, so we'll just start right away. Before we start the meeting though, we have, some announcements, from.
We have to do roll call first.
Yeah.
Okay, no, everyone do roll call. Okay, so we will do the roll call first before we take the announcements. Larry?
Maybe,
Here.
Larry Fan, present, Eric Diaz,
Yes. Here.
Tanisha Fields, absent, Naima Fafanu, absent, Romeo Rao,
Here.
Anna Kakar,
Here.
Robin Oliveris,
Here.
Kendrani Rivera,
Here.
Arnett Scott, absent, Carmen Perez.
Okay, so now, so before we
Was
start
that
the
the house
meeting,
bill?
we will have, one announcement. Are you both from the same organization? Yes. Okay, so Heaven Street? Yes. Okay, from Heaven Street Settlement. Oh, why don't you come up here, make your announcement? I believe you need to talk into a mic. Okay. Here, I'll do a quick comment.
Hi.
Yeah, or you can pick it up if you want.
Hey, go pick it up and stand over there, or, you know. Right.
Hi, my name is Destiny, and I'm with my partner Annabelle, and we work at Henry Street Settlement. And we just wanted to share with you guys, information about a free cancer screening program for individuals with no insurance. And for individuals who are 40 and over for women, and over 45 for men. And these individuals with no insurance can get free screening for breast cancer, cervical cancer, and colorectal cancer. So we connect them with, Will Cornell Imaging to do breast cancer screenings. And then we connect them with the Tonsils Health Center for cervical screening, and we will mail them FOBT kits for colorectal screenings. And this is, again, free for people with no insurance. If you are a woman over the age of 40 and a man over the age of 45. And we share like flyers with you guys, or not sure.
I have a question for you. If they're screening found to have cancer, what treatment do they get? It's accessible.
So if they are screened and found to have cancer, they are turned over to a case manager. They're turned over to a case manager, and she will enroll them in the NCP program, which is the Medicaid Cancer Treatment Program, which will cover treatment for two individuals.
Thank you.
You know why?
Oh, there is.
This quick.
Yeah.
Everyone voice.
Speaker for my.
What are the hours?
9 to 5.
Oh, here you go.
On to the week.
Okay, here, do you wanna, you have to call first. You can sit down.
Yeah.
Figure
And
it out.
that's one of them, then.
Okay, we have another announcement.
Thank you.
Thank you.
Thank you.
Okay, hey guys, so it's. Hey everyone, so since we're, since it's on Zoom also, or there are people in the Zoom. We should speak one at a time so that they can hear what's going on, and when you're actually speaking, you should turn on your mic, because they actually can't really hear much of what I'm saying right now anyway. That's why I turn it off.
Okay,
Okay, so we have a second, community announcement. Could you introduce yourself, your organization, and what it is you're announcing?
you're on.
Hello.
Go ahead.
Hi, my name is Dr. Hernandez. I'm coming over from Manhattan Restorative Health Services. We've recently opened a new clinic on the 103 Norfolk Street. This clinic provides primary care services. I myself as a family physician, I'm going to be there staffing. We also are going to be providing chiropractic services, pain management, and that of mental health services. We just opened in the Blue Building there, so we're going around meeting buildings, urgent cares, and different organizations to see if we can collaborate. That's why I'm here tonight. Good to meet everybody.
No, so it is, if you have any brochures or information, it would be good to, you can give it out here.
Okay, so Department of Health is on that. So like Elena is the speaker.
Hi, should I go ahead and get started?
Okay, just 1 minute.
Oh, sorry.
Thank you.
Thank you.
Hi there, okay, so we're going to start on the agenda, our first agenda item is from DOHMH. And our speaker here is Elena. So Elena, could you just introduce yourself and start your presentation?
Sure. Thank you so much for having me. My name is Elena Pereira. I'm a health legislative research analyst at the New York City Department of Health. I work with Ricky Wong, who connected me with you folks, and I'm happy to be here today to provide a little bit more information about a legislative priority for the agency. So it is, I can drop some information to have follow-up information so you guys have some notes, but essentially, we have a longstanding issue where the city's health department does not receive the same reimbursement rate for public health services as every other local jurisdiction throughout the state. So it's called Article 6. And so Article 6 of the public health law for New York State determines how much state aid money a city gets for basic public health services. This includes vaccination, STI testing, HIV testing and treatment, tuberculosis testing and treatment, disease outbreak surveillance and prevention, lead poisoning prevention and investigation, chronic disease prevention, overdose prevention, and so many other core public health activities that protect the health of everyone in the state and the city. So what we are always asking for support in is pushing the state to restore our reimbursement rate. In 2019, the state cut only New York City's reimbursement rate from 36% to 20%. So that has left the city losing about $90 million a year that would go directly to all those activities I just described. The state, the Assembly and Senate had introduced a bill last year or last legislative session that would restore this. The City Council has also passed a resolution in support of this bill. I'm happy to share links to these as well as advocacy material from the New York State Association of County Health Officials, because they also support reimbursement, restoration of reimbursement rates for New York City. So, and I'll just say another reason, like why now? This has been since 2019. As everyone I'm sure is aware, the current federal administration is not, does not necessarily align with our view of public health and is targeting many core public health competencies and philosophies. And the city and state are both at risk of losing federal funding. And the city receives direct federal funding for public health activities. So it's more important than ever that the state ensure there's equity across all local jurisdictions in public health funding to ensure that we're really able to continue to execute on our mandate of protecting the health of everyone in New York City, as well as the state having to execute on their mandate of protecting the health of everyone in New York State. So I'll pause there. Happy to answer some questions, and we'll follow up with some details that might be helpful for folks.
Yeah, are there any questions? And also, the committee doesn't have the written materials yet, but,
It's on the website.
no, I don't see it.
Oh, the resolution, you mean the draft resolution?
I didn't send it to them yet, because I usually don't.
Oh, okay, but we have it
I
here.
can do it in.
Okay,
I can also put on the screen.
okay,
Could I ask a question?
Okay, so we're taking questions and, Eric and Susan, or Susan and Eric, who wants to go first? Eric, Susan, and then, Arnett.
My question is just, what exactly do you want us to do with this information?
Not sure if I'm sorry if someone's speaking. I can't quite hear.
No, can you hear me?
You were just speaking very low.
Hi, I would just like to know what you would like us to do precisely with this information. You gave a lot of good information, but is there any?
We have a draft resolution.
Okay, so we'll talk to review that. Okay, fine.
Okay.
Oh, fantastic.
My question was, you know, it sounds like it's something we seriously need. Do you know, like particularly in Manhattan, what state elected officials have been supporting this, you know, whether, you know, so who we should be reaching out to?
That is a good question. So the sponsors of the bills, let me pull this up right now. Gonzalez Rojas, I don't believe they're Manhattan. You know, I don't have, it looks like I can send something in a Q&A. So I can drop the link to.
Yeah, if you could just do that, and we, even if we use it afterward, it'll tell us who to.
Yeah.
Advocating to.
Apologies. Yeah, I think I'm not able to use the chat function right now. So I can follow up in an email with the legislation, which should have the sponsors, and then that'll be indicative of you know, if anyone we know is very supportive enough to co-sign on this legislation. And you know, one, it's not Manhattan, but I do know that Senator Rivera is very supportive generally of the health department's priorities, and I think was also the Senate sponsor for this.
Okay, you have me on an email, that Ricky Wong sent, so if you could just forward the information to me, that'll be helpful.
Yes, yeah, I will forward the bill, the advocacy material from the state association of state association of county health officials, and also the city council's resolution, and that should be pretty helpful, hopefully, for what we've just discussed.
Arnett? Use-
I have a question. I'm sorry, can you hear me?
Yes, I can hear you.
My question to you is the lowering of the New York City rate, is this? Do you know the rate, was the 36% due to COVID? And then it went down, or was it 36 prior to COVID and then go down?
So it was 36% prior to COVID, and then in 2019, the state lowered it to 20. And I believe the argument at that time was, oh, well, they received more federal funding than other jurisdictions. You know, I think, I mean, at the time we were like, well, we are a very, very significant, we're actually the largest public health department in the country. So we get state, city, and some federal funding. During COVID, as we're all aware, you know, there was a lot of federal resources that were sent to the city, and particularly the health department. But as the urgency of the pandemic waned, so did the federal funding that was, you know, really just intended for emergency. So it became less of a priority because we were focused on COVID for one, and also had, you know, this influx of resources. And then that has now sunset, and they never reinstated the reimbursement rate. And so now, you know, we've continually had kind of a drumbeat of trying to get folks to learn about this and to, you know, advocate to the state in the ways that they can. But we're kind of renewing this discussion even further and looking at other ways of engaging because of, you know, the very dramatic shift in the federal environment. So the 36% was there for, I don't know exactly the year, but for a very long time. So it was a pretty dramatic change in 2019.
All right,
Yeah, Carmen?
hi. And keeping with this vein, of the reimbursements and of course, in advent of this new bill that just got into play on the federal government. Um, I don't see a problem with the state doing what has to be done. However, um, you know that you guys are in the range with everybody else for the same Medicaid dollars. With this bill going through, and I'm talking about the federal one that's slated to start on January. How would that affect you all if, again, the reimbursements don't add up?
Yeah, so that is a very important question. So our commissioner is working closely always with OMB and law department and all of our program experts to understand the impacts on our budget and our programs from the federal changes. We, in terms of Medicaid specifically, we do not receive as much Medicaid funding because we're less direct service. That's actually more for the state. But many of the contractors and CBOs in the city do use Medicaid, and we generally serve the Medicaid population. So that to say, there will be fewer resources going to the New Yorkers that we also seek to serve with our, we serve everyone, but also, in the public health department, we're always trying to reach those who, are most disadvantaged and the most need. And so that may also, overlaps with people that are on public insurance. So from what I can say right now, we're still analyzing all the different scenarios that could play out and how these federal changes will impact our programs. We will always remain the public health institution for the city. We will do every single thing we can, and we will continue. It will take a lot of change, dramatic change beyond what's even happening for us to continue to deliver for New Yorkers. It's just a matter of how much we can do. So thankfully, we'll be a little bit more insulated as an institution for changes to Medicaid. However, the people that we serve will certainly be impacted and the need will be greater. So I also think that adds to the argument for the state to restore our reimbursement rate, because it's really a great return on investment for them, because they'll be dealing with the same issues, because half of Medicaid recipients in the state are in New York City.
Are there any other questions? Susan?
Just to sort of cut through what you just said, isn't it true that most of the federal money comes to us through the state? So we'd be getting it from the state, even if it's federal?
So for public health, I can't speak about everything else. Public health in New York City is unique, where typically cities don't receive federal money. Often it's through the state, and that is the case particularly for mental health. But for some disease control purposes and emergency preparedness, the city health department does receive direct federal funding. Our commissioner has taken part in a lawsuit against the federal government, where we've actually been in a holding pattern for I think 5 months now, where the federal government has tried to rescind about $300 million of direct funding to New York City's health department. That they are not able to act on that right now because a judge has issued a holding order. And this is all, we're part of the coalition of organizations working with the state attorney general to ensure that, some of these changes at the federal level are not able to actually happen, because they would be detrimental for the health of the United States. So we do receive some direct federal funding compared to other health departments. We actually have a pretty great investment from city and state. So we're not as vulnerable, but of course, we need as many resources as we can to really protect the health of New Yorkers.
A final call for questions. Okay, so in front of you on the screen, there is a draft resolution that we are being asked to support.
Someone read it?
Yeah, I think it would be good if it were read aloud.
Motion's titled. Support for New York State to increase the NYC Department of Health and Mental Hygiene's reimbursement rate under Article 6 of the NYS Public Health Law, 20% to 36%. Whereas Article 6 of the New York State Public Health Law provides reimbursement to local health departments for eligible public health activities and services funded by local tax levy dollars. And whereas under the current law, New York City's Department of Health and Mental Hygiene receives 20% reimbursement rate, while all other counties in New York State receive a 36% reimbursement rate for the same types of public health services. And whereas this inequity in reimbursement rates results in millions of dollars less in annual state public health funding for New York City, despite the city's much larger population density and complexity of public health challenges. And whereas equitable state reimbursement would allow DOH-MH to expand critical local public health services, including increasing home visits for newborns, particularly in neighborhoods with disproportionately high maternal mortality rates among Black and Latino mothers, extending clinical hours for sexual health, tuberculosis, and immunization clinics, expanding the distribution of naloxone kits to community-based organizations to prevent overdose deaths, and strengthening surveillance and enforcement for drinking water, recreational water, and building systems, including cooling towers, to prevent illnesses such as Legionnaire's disease. And whereas investing in New York City's public health infrastructure benefits not only the city's 8.5 million residents, but also the state as a whole, given the city's role as an economic transportation hub. And whereas the New York City Department of Health and Mental Hygiene, along with other public health advocates across the state, has requested that the New York State Department of Health and the governor increase the reimbursement rate for New York City from 20% to 36% to bring the city into parity with other counties. Therefore, be it resolved that Manhattan Community Board 3 supports the New York City Department of Health and Mental Hygiene's request to increase its Article 6 reimbursement rate from 20% to 36% for equity with other New York State municipalities. And be it further resolved, Community Board 3 urges the New York State Department of Health, the governor, the state legislature to take the necessary legislative and budgetary actions to implement this increase and ensure that New York City receives its fair share of state public health funding.
Okay, we could, okay, are we ready to vote on this?
Yeah.
So, yes, so since she's here.
You wanna put her back on?
Is she back on?
Oh,
I was gonna stop. And stop sharing.
no, she's doing this,
Okay, so we'll vote on it now, since, Elena, since she's here. One by one, or her voice, a roll call vote for this, yeah.
Okay. Maylee,
Yes,
Ariel
Yes.
Chen, yes, Eric Diaz,
Yes.
Ramya Rao,
Yes.
Annika Carr,
Yes.
Carmen Oliveras,
Yeah.
Indrani Rivera,
Yes.
Arne Scott,
Yeah.
Carmen Perez.
Yes.
okay, so it passes, and then, the next thing is it'll, be voted on at full board, which is, the end of this month. October the 23rd. And then after that, you know, if it passes, it'll become our position, Susan will send all the information out and the resolution out to you and all the relevant agencies.
Thank you so much. We really, really appreciate it. Really appreciate the advocacy and the support. Thank you so much for having me join tonight.
Okay, thank you. Okay, so our next agenda item is, from School District 1, I see Christine. And possibly.
Superintendent Chan is on the call.
She's promoted to panelist.
Carrie also.
Yes, she is, or she was. Now she's.
Hi, Carrie. Hi, Christine. So Carrie and Christine are here from School District 1 to talk to us about their plan for a new D1 care center for families.
Yeah.
Take it away.
Hi, good evening, everyone. Can you hear me?
Yes.
Yes.
Oh,
Yeah.
good. Yeah, good evening, everyone. I'm Carrie Chan. I'm the superintendent of District 1, and my partner Christine is also here with me. Before I get into the family care center, where's Gravin? I thought I saw her before. Is she here? Gravin, hi. Can I just tell you something really funny? I was worried that you didn't know that I was here, so I was texting you to make sure to promote me as a panelist, and I see you putting your phone down to charge. So I was like, oh, she would never get my text this time. But I'm glad you saw me. So I'm just excited to share that, well, excited and glad to share that in partnership with Trinity Church Wall Street, District 1 is able to secure a food pantry for every single school in District 1. And prior to this, we only had 5 sites that were partnered with Trinity Church Wall Street with a fully stocked pantry. But because of the interruption of the SNAP benefits and just other challenging circumstances, we worked hard to make sure that all of our schools are going to be fully stocked with food, perishable, both non-perishable items. So I wanted to share that with everyone. And our amazing Gravin and our former CEC1 president, Lila Mejia, is really sort of leveraging, also galvanizing, other CBOs so that we continue to have these pantries stocked throughout the year. But yeah, so we really want to give a huge shout out to Trinity Church Wall Street for supplying all of our schools. Every single one of our schools will get a fully stocked pantry. Isn't that great, CB3? Yeah.
We already knew, some of us knew, so it wasn't a surprise, but it is great.
Some of us some of you already knew. Oh, you were at the meeting on Monday?
Yeah, we go to your meetings, too.
Oh, yay, that's great. But see, you didn't tell me. I wanted an element of surprise.
Sorry.
But it's wonderful. And I do want to publicly be on the record to thank Lila because, the power of social media, she put out a very powerful reel on, I think it was on Instagram or Facebook, somewhere I saw her reel, and she was really calling for us to take action as a community. And she was willing to adopt a family, to make sure that families can really go through the rough times. And it really struck me, like I'm like, wow, like, and not that we're not aware of these urgent matters, but like, we really need to have a more holistic approach to supporting our families. And so Trinity really stepped up. So, I'm very, very happy. And we're probably going to invite news media here because it is a big deal that all of our families will have access to this. And what's important is that every family will get 1 week's worth of food, and then the pantry will be replenished as needed. And also the pantries will be replenished for the holidays as well. So it's great. So I'll give more updates as we go along, but our families are super excited and glad. And so with the community care center that we have is a while ago, we had a family resource center. We got it through a state grant. And the whole idea of the resource center is basically a one-stop shop resource hub for families. And so this space, what we envision it to be is it will be a space where families will come and get access to information. We all know that information and knowledge is power, right? And we all know that there's so many resources in the Lower East Side that are untapped. And so we believe that this space, what we envision this space to be, is to have CBOs, other partnerships, private partnerships to come and table. And these tabling dates will be public to our District 1 families. And if families, let's say they need, I think we just had a prior presentation on access to healthcare, something like that, or some sort of obviously public service. So for example, we had a table for the Department of Health one day where families want to get at, obviously have more information for healthcare. They would come on that day at that time. So we're envisioning that space to be that. one of the circumstances that we have to consider is that it's actually, obviously, we share the building with another school. So the school also uses that space for enrichment. So we really technically have that space for 3 days. And then the other days, we actually have an enrollment specialist that is there to help families enroll in District 1 schools. I'm happy to get suggestions, and we are certainly happy to host CB3 meetings there. And any sort of public forum, we'd be happy to also participate. Any questions?
Yes, are there any questions? Please raise your hand. I'll call on you. Eric.
Superintendent, quick question again, the location of this center?
Can someone speak? It's a little muffled.
He wants you
The
to,
location.
say the location of the center.
Oh, it's at PS 20, 166 Essex Street. So it's pretty local, not too far away from where you are.
Yeah, we have meetings there every month.
Yeah.
Oh, yeah, there you go, in the auditorium.
Eric, it's the place where we have meetings every month.
Yeah, you have it in the auditorium, right?
Yes.
Yeah.
Any other questions? Susan?
Is there any way that Community Board 3 can help support you? Help support this resource?
Of course. I mean, we love to, obviously, one of the things that I was unable to make the meeting on Monday, unfortunately. But Christine, you can actually unmute, because I know that one thing that all the CBOs realize, that like everyone can share resources. How do we leverage each other to really have a collective resource hub? Right. And Christine, can you just maybe share how we might be able to do that through the care center? Because I know that's what that was what came out of Monday's meeting, was tightening up these partnerships.
Yeah, so one of our immediate next steps is to engage some of our stakeholders in a focus group so we can find out from families, how they would like to see the space be utilized, what would be most beneficial. A lot of times what we hear from families is that it's just helpful to have another location that is perhaps more accessible and more familiar to them to access services. That is why we have the Family Enrollment Center there on Mondays. So that's 1 day a week where families don't have to go all the way to 333 7th Avenue. They can come here to us. They can speak with someone they know. They can speak with our family team. So that's a big part of it. And we also want to get feedback from our CBO partners, how they would like to utilize the space and what makes sense for them to bring to our location. So right now, that's the process that we're engaging in to maximize the use of the space. And I think in terms of how to best support, I think it's just part of that. It's part of giving feedback for what you know from what you're hearing from the community, so we can plan for those things. And then if you are aware of resources that you think will be valuable to bring for families, letting us know so we can schedule time for them to be in the center.
Okay, so I actually have a couple of questions. So what is the timeline for this? Because you said you wanted to get some feedback from the parents,
Yeah.
and the families in your community. And then you want to have these partnerships and these tabling days. So are you going to do the feedback from the families first and then figure out what you want for the tabling? Or are you sort of doing everything at the same time?
I don't know that we envision it so much as tabling, but we're already in the process of speaking with families to see what they'd like through the superintendent advisories and through other forums. So we are already in the process. I think we'd like to move it more to a specific focus group, but we are in the process of collecting feedback. So I think before the winter break, we would definitely like to have that solidified. In terms of resourcing the space, we had a CBO utilizing the space part of the time. The school had launched using the space, and we weren't fully clear on the schedule for the enrollment center when it was being accessed. So we were just working through a few of those details. but I think we're hoping to launch in the new year. And again, our vision, it could be tabling, it could be that CBOs are there and present, but we're also thinking about, for example, we work with University Settlement Families Thriving. So we're thinking about maybe having some of the work we do there with family circles and supports happening in that location. Or it may be a workshop on special education, or it might be a workshop on job preparedness or English language learning classes. It might be information sessions, and also a place for people to come together, not just tabling.
Okay, so.
Yeah, and right now, sorry, is someone speaking? Right now, this, I can't even use the space right now. They're using the space for a book fair, PS20. So it's such a flexible space right now. But once we have a schedule by the winter break, we definitely will share the schedule with everyone. And if you have any ideas that you would like to table and meet some of our families, definitely let us know as well.
Yeah, and so we're to Carrie's point, the space has been used as a flex space for the past few months. We are working with Principal Pinto, who is the principal of PS20 and who we reside with, to one, upgrade the furniture that's in there, so that we have more flexible seating and space, and then to work out. Essentially, we'll have a Google Doc, a sign up schedule, so that we can know who wants to be in the space and when, and of course, we'll collaboratively plan with anyone who's interested on what that can look like.
And is that Arnett? Hi, Arnett. Sorry, let's see my friends here. Arnett, I wanted to also share that even getting a budget to buy furniture is hard for us. So I was able to get some money from private funding to get us even furnitures to make the place look very cozy and inviting. So that's all in process as well. So if CB3 wants to sponsor a space for us, we'll be happy to take some discretionary funding as well.
And what's the ask? What's the amount?
As much as you can and as little as we'll take anything as of now.
I'm excited to hear about this because I remember when we did the grant to get the
Yes.
Family Resource Center.
Yes.
It was somewhat disheartening to see it not being used as it was intended. So
Mhm.
I'm so excited to hear that it's going back to the original sort of mindset of being somewhere for families. And I'm interested in knowing if you're thinking about or thought about how we can use possibly this space to help our have a safe space for our migrant immigrant families, as well as those that may be
Yep.
vulnerable at this point due to certain
Yep.
federal administrative stuff. I'm trying to be as as possible. Circumstances, correct. For our families within our public school system as well as our community.
Absolutely. Thank you. Absolutely. I mean, that's the whole intention, is obviously bringing the services and knowledge locally to our families, especially our most vulnerable families, for sure.
And if I could just add, so we did have one event for our families earlier this fall at Middle Church. And so that is something that is always on our mind, ensuring that we have supportive gatherings in safe spaces where families can access a range of resources. So this place can definitely be that. We had an event last year at Henry Street. So our CBOs have been, certainly strong partners in that. So in schools and beyond.
That's right, Christine. Gravin was there at our newcomer event. And we had a really pretty good turnout, right, Gravin? For sure, like creating, making sure that the space is safe for our migrant families, definitely a priority.
Yeah, I had this, my second question was about the SNAP, about the Trinity Church food distribution.
Yeah.
So we now have it in every school, and you made it sound like it was because of the SNAP, situation we're having with the SNAP benefits. So once that goes back to normal, are they gonna scale back on that?
I didn't really like it doesn't sound like it, at least. I know that, like, for sure, obviously these resources should definitely go to where it's needed the most. But for now, like, they said that replenish as needed. So I'll take it, right? But either short term or long term, the fact that we have, the fact that schools now are all set up. I mobilize my custodial staff, really trying to get the word out to parent leaders so that they can help with distribution. Deliveries are still scattered throughout the next 2 weeks. 'Cause there's a lot of logistics to coordinate. But once the first delivery comes in, because it's pallets of boxes, and so there's also regulations on, like, whether we can have DOE or public school folks to lift boxes. So, like, things like that we have to figure out, because we don't want anyone getting hurt lifting boxes and so on and so forth. But once we have all those ironed out and see how smooth it runs across the district, I'm sure that it can be sustained.
Okay, thank you. Are there any other questions for Carrie or Christine?
Oh, I do have a request. A question or request? What did you say? Did you say request or question?
No, I was asking the committee if they had any questions
Oh.
of you or Christine. But do you have a question or request?
I always have requests. My request is, so not all of our schools have fridges, for non-perishable items. And so I don't have the inventory which school has a fridge. I mean, obviously we have fridges in the school cafeteria, but I really don't, I want to keep that separate with school food and the pantry. But if there's discretionary funding where we can purchase fridges for schools that need it, that would be fantastic.
So we don't have discretionary funds. We have a small budget that our council members add to. So we advocate for city council and for our elected officials to give, discretionary funds to you. But we can't actually do it ourselves. And if there's a very small project, the board might look to see if they could support it, but
Ah, I see. Okay.
Mhm.
Okay.
but we do meet with, at this time of year, do meet with elected officials. That's why when we just submitted our budget requests, we took the top 5 capital requests from CEC 1 and put that in our budget requests that we're advocating for.
Thank you for that. Yes.
So we always, want to know what your needs are, not that we can fulfill them, but that we can help advocate for them.
That
And
was
if
great.
I
Thank you.
could just mention one other thing, excuse me, let me get rid of this. If I could just mention one other thing, I sent this information both to Gravin and Katrina. The Hospitality Alliance is giving grants to nonprofits, and 2 PTAs have already applied and received this. They get money, it's restaurant money to spend at local restaurants for food.
Oh, that's
And which, like I say, the PTA seem very equipped to be able to fill out these grants immediately, and they're getting responses immediately.
Oh, that's wonderful. Now, Susan, maybe this may not be the meeting for it, Susan and May, but like I would love to think through what is a good way for CB3 to streamline these grants and communication directly with the district. In addition to emailing. I'm just wondering, because like any sort of grant up, because I know CB3, you guys have a really huge platform of a network of resources, timely resources that maybe obviously my district may not know about. And so I'm just wondering how we can streamline some of these opportunities and communication.
I don't think they happen often, but I think it would be good for us to have a way to communicate, because I didn't even think of the schools. I sent it to East Village Community Care Coalition, and she sent it to the PTAs, and then I started sending. So
Got it.
I think we should set up a Zoom meeting very soon to talk about a way to do that, and to also update you with our meeting we just had with the chancellor.
Yes, yes, that would be fantastic. Christine, did you want to say something?
If I could just add, I think it would also be helpful. Some of our schools do this already. Our schools that have existing pantries have expanded those pantry options to include non-food essentials. So if there are if there's any awareness of places that would donate things like diapers, toilet paper, deodorant, those sorts of things, we'd also be interested in connecting with those places because we know that's a need for our families. Our schools do a really good job. Many of our schools are partnering with Operation Warm this winter to make sure students have coats. Many of our schools often partner with places like Nordstrom and Nike to make sure students have access to footwear. But we know that there are non-food essentials that people need, and so also interested again in being partnered with any of those, contributors.
Yeah, I think that would be a good idea to streamline communications on a lot of things. So as Susan said, there needs to be a call about how to do it.
Yeah, well, definitely, I'm happy to follow up with another call with you to talk through that, so that these resources land even more timelier to our families and schools.
Okay, very good. Okay, so I think we're ready to move on to our next agenda item. Yeah, and you're welcome to stay, but you're free to go.
Bye. Take good care. Be safe, everyone. Okay, bye.
Bye, thank you.
Should we still, we still need to record that. We should turn on the mic when we talk, right?
Yeah.
Okay. All right, so our next agenda item will be the senior advocacy leadership team. All of you are here in person, is that correct?
Well, there's four here. I don't know.
Is there anyone on the Zoom that decided to?
They were thinking.
Oh, sure. Okay, so Susan's going to check to see if any of your members are all set signed in on the Zoom.
I don't see any names I recognize, but I guess after the presentation, we can just ask people to raise their Zoom hands if they want to speak.
Okay, so we have, so this is about the New York Health Act.
Yes, and good evening, everybody, and thank you for the opportunity to talk to community for free at the New York Health Act. My name is Anne Lislander. Grew up in this neighborhood, Lower East Side, but it's here. I was calling to see all of the different activities that are going on in how the community has really continued to come together. I want to talk tonight about the New York Health Act. It's an issue that's very close to my heart. I'm a retired primary care doctor. I've practiced medicine for more than 40 years in New York City, working in community health centers. And I've seen over and over again and more frequently the human tragedy of being uninsured or underinsured. I have had patients who could not afford the copays on their medication or the copays required by their insurance companies to see a medical specialist. I spent hours and hours literally on hold on the telephone trying to speak to the insurance company doctor to get approval for a much needed life-saving test or medication for a patient of mine after the insurance company turned them down. Now, as a retiree on Medicare, and like most seniors, having lots more medical problems myself, I'm worried for myself and for my peers. Recently, I ran out of my diabetes medication, And between delays in hearing back from my primary care doctor, my Plan D insurance company, which is United Healthcare, suddenly requiring prior authorization for medication I had been on for several years, and medication being out of stock in the pharmacy, I was without medication for 3 weeks. I'm pretty stable medically and was able to monitor myself. Another person might have ended up in the hospital with a hyperglycemic coma. The New York Health Act would guarantee health insurance coverage for all New Yorkers and all people who work in our state, regardless of age, pre-existing conditions, or immigration status. The New York Health Act covers all health needs, including primary and specialty care, dental, vision, mental health, and most important for us seniors, long-term care. And I'm fortunate, I have Medicare. Over 1 million New Yorkers had no health insurance. And last month, Governor Hochul announced that because of the loss of $7.5 billion in federal funding, New York State will have to cut its essential health insurance program, leaving almost 500,000 additional New Yorkers without any health insurance. The recent cutbacks to Medicaid, Medicare, and the Affordable Care Act, voted for by Congress as part of the one brutal bill, as well as the present federal government shutdown, has made these problems much, much worse. We're now in the open enrollment period for Medicare plans and for health insurance marketplace plans. The average monthly cost of health insurance through the Affordable Care Act marketplace was $283 a month in 2014. In 2026, it will be over $600 a month for individuals, and of course, much more for families. People covered by insurance through their employers are also seeing a huge rise in the employees' contribution, and are seeing an increase in the size of deductibles and co-pays. So people are forced to buy insurance at higher rates that offer lower services and more out-of-pocket costs. Hospitals in New York City in New York State are at risk for closing due to the burden of caring for the poor and uninsured. And the cost of caring for the uninsured will rise as people get sicker and sicker from not having access to primary care services. The New York Health Plan will cut costs of healthcare while expanding access to services. It is comprehensive. It is financially feasible, even in the face of presently threatened federal cuts. It will be funded through a progressive tax on all New Yorkers, which will cost many families much less than what they are already paying for health insurance premiums. And any family or individual earning less than $25,000 a year will pay no taxes and still be covered by the New York Health Act. So tonight, I really want to urge the community board to pass a resolution supporting the New York Health Act and to contact our assembly members and our state senators, both of whom already support the bill. The problem with this bill is that it has been stuck in committee in Albany for years and years. This is really the time, given the situation with the federal government, that this has to come out of committee, that we have to vote on it, and we have to really put it into practice. And I don't think I'm exaggerating to say that our lives really are depending on it. I want to thank you and urge you to pass the resolution supporting it, which is up on the board. Thank you.
Okay, so, okay, thank you very much. So before we consider the resolution, we'll take questions from the committee members. So committee members, if you have a question, please raise your hand. I will call on you and then you can speak. Yeah, Johnny, and then Eric.
How much, you said that the money will come from taxes? Just curious, because people, always respond to how much money they're gonna have to spend, so do you have a dollar figure on what that will be?
I don't have the dollar figure, it's gonna be an additional payroll tax. So sort of like what we already do with Medicare, the argument is that, if you look at shareholder dividends and all the administrative costs that the insurance companies and the advertising that they do, about 25% of what we spend on them is unnecessary. So it would, first of all, it make to cover all the things that they cover, would be a lot less money. There would be a payroll tax. I would argue, though, that if companies didn't want to pay taxes, they wouldn't open up branches in, say, Canada or in Ireland, which has nationalized healthcare. But companies have no problem going there because, one, it relieves them of the burden of finding an insurance company every year when the premiums go up. It relieves them the burden of having someone in HR handling all that insurance claims. So there's a lot of latent costs that companies bear that they wouldn't have to bear if there was a single payer system. Is that answer? I don't have I can find the numbers. You know, we didn't come up with the plan. It's a former assemblyman, Richard Godfrey, did like years ago. And what we're trying to do is just getting people aware of it, and it's been around that long, especially in this situation, because with the federal government cutting things back. So we're just asking people, look at the problem, think about it. If the community board is ready to pass it, that's great. We're essentially being evangelists about it, you know, and saying, you know, please look at it. We're finding so many people we know who tend to be high information community members don't know about this. So we're really trying to just get it out there. We might have the numbers somewhere there. I don't know if you do, you know.
I don't, we can look at it, but one of the sets of numbers has been crunched. That is really, I think, persuasive and important to think about is the amount of waste in the system as we're living in and trying to get taken care of. As it is now, in every community health center that I've worked at, we have a huge billing system. Because every patient has different insurance. Patients have more than one insurance. The amount of absolute waste that goes into the administration of a very dysfunctional health system is huge. And having a single payer system would cut a lot of that waste. And ultimately, I think be much less expensive. You know, we think about what this process is about with prior authorization. Not that I got paid overtime because I didn't, but we had a whole staff of people in our health center who did nothing but make phone calls for prior authorization. That's a tremendous waste of business. And when the patient finally got turned down, then, you know, us doctors and nurses would stay overtime waiting on the phone to be through the process that's called peer review. And the insurance companies were paying beyond the other end of those phone calls and paying clerical staff to be on the other end of those phone calls. It's a tremendously wasteful system that we have now. And what the New York Health Act would do is really consolidate and lower those unnecessary administrative costs. The other thing to think about is that if this is funded through payroll tax, remember that with the New York Health Act, both employers and employees would not be paying what they're presently paying for health insurance.
Just quickly, one of the documents I sent to Susan, I'm not sure if everyone got it, all about the New York Health Act, doesn't talk about how much taxes would go up, but it does go in a lot of detail about where the savings would come in all different places. So that might be helpful, might be hard to estimate how much it's going to cost because depending on future population.
Yeah, so we did, you sent 2 more documents later, I think, so we did forward that to the committee members, although I think it was just yesterday.
So yeah, might not have had enough time, but especially with the election going on. But but there is one. But if people want more numbers, Susan knows how to reach me. I can try to have them for the full board meeting.
Well,
If I can.
I don't think.
No, I think Eric and then Susan.
There a reason why it's stuck at committee at the assembly? Is it certain assembly members over the years? Is it because of a question like this that, you know, we don't have numbers? Do we have a sense of why?
Our theory is, it's right now, there's more Democrats than Republicans on the health committee. But it's tied, I think 1919 with 4 or 5 Democrats abstaining. And we sort of have a feeling that it might be the Assembly and the Senate leadership asking them to abstain, because they actually don't want this to come to the floor. Well, the tax issue freaks people out if they just hear tax and they don't go in. So, I mean, but that, that's just, you know, our political conspiracy thinking, you know, it's nothing, we can't figure out another reason for it. Especially, I think 4 of the holdouts come from one of the 5, or not from Staten Island, they come from Queens or sorry, one of them is from Riverdale. So, we don't know where. But that's our best guess.
But what we do know is that the health insurance companies do a lot of lobbying and a lot of campaigns for their tax. There's a lot of financial incentive for them to be able to stay in the business, which their business would be eliminated by this act.
Susan?
I'm wondering if, since New York City has so many thousands of employees and is constantly trying to save money on our healthcare, I'm wondering if there's any position from the city. I mean, you're saying it could actually, sounds like it could actually save money. And just this month, the municipal unions and the mayor made an agreement to take away our current health insurance and substitute inferior, not just for retirees, for the whole workforce. So I'm wondering if there's, if there's any position or any discussion with the city.
I think we'll have to ask, again, we're sort of doing this campaign, we'll have to ask people who are sort of running the overall campaign. I know there's a couple unions are split different ways. Part of the reason.
100, I think it was like 100 municipal unions support taking away from their workers and the managers.
Well, that's right. Because I'm a retiree from New York City. I worked at Groove, and what we found out was that they're really willing to burn the retirees. Now, right now, apparently that's not being changed because when we retired, there was a promise set up. But for the active employees,
Yeah, we're all
they are changing, so they're sort of reversed the approach. And what we heard from, and again indirectly, that the union leaders, I'm saying the rank and file, the union leaders, occasionally a couple of them oppose this because they want to use healthcare as a bargaining chip in their negotiations, which sort of doesn't make much sense to me, because why wouldn't you just want to campaign for more money and better work conditions and have the healthcare be taken care of? But as you stated, some of the unions have burned their own members in order to the negotiation. So I know that 1199 is behind this because I guess they want to keep the hospitals open because their membership works at hospitals. In terms of the city, I'll have to find out where we should have asked them when they were here in the beginning.
I think it's worthwhile, because with so many thousands of employees, if we could get the city, particularly since we have a new administration coming in, if we could get the city behind this, might make a difference.
Right, no discussion. Go ahead.
So I would just second that thought. This is a great opportunity now to look at this question again. In terms of some of the bigger unions, the 1199 supports this. The New York State Nurses Association supports it. I think the Communication Workers America supports it. District 37, not, no one supported it. And again, I think it's, what Bill said and what other people have said, this has become a tremendous part of what trade unions can offer or feel they can offer to their workers, but I think this is a real, having a new administration in the city, this is time to revisit. That's why I'm really hoping the community board will pass this resolution, because it just gives more weight to it. It shows that there's support of the grassroots level and of the community support.
Okay, any other questions? Okay, so seeing none, we do have so kindly drafted a reso for us to consider.
Well, it's part of the plate. If you wanna change it, I mean, obviously, but
Okay, so
why don't I make it easier for you?
we're always happy when you make it easier for us. So thank you for, making it easier for us. So the boilerplate is in front of you on the screen. You can see it, we'll read it out loud and discuss it if we have any changes, we can change, and then we can vote. Yeah, Larry, could you read it out loud?
Yep.
Okay.
Whereas, healthcare is a basic human need without which one's lifetime is shortened and one's freedom restricted. Whereas New York State is facing a healthcare crisis, which is about to deepen because of cuts to the healthcare in the federal budget, which will lead to doubling the number of uninsured, skyrocketing insurance premiums, and closing of hospitals. Whereas federal public law 119.21 will become effective on January 2026 and severely and negatively affect New York State's Medicaid and Medicare programs by cutting benefits by $1 trillion. Whereas the proposed federal budget will cut out subsidies for people who buy health insurance through the Affordable Care Act marketplace. Whereas there are 6.9 million New York State residents on Medicaid, 3.9 million New York State residents on Medicare, and 17 million New York State residents buying health insurance through the Affordable Care Act. Whereas 1 million New York State residents now have no health insurance and many more are underinsured. Whereas uncompensated care from uninsured patients costs New York State billions of dollars annually, including $3.2 billion in the fiscal year 2025 budget for financially distressed hospitals and a typical $3.6 billion for disproportionate share hospitals in recent years. Whereas 70% of senior citizens and over 1 million disabled people in New York will need long-term care in their lifetimes. Whereas uninsured and underinsured New Yorkers are more likely to forego needed medical care and more likely to report being in poor or fair health than fully insured New Yorkers. Whereas the average New Yorker currently spends $10,191 per year on healthcare costs, whereas 740,000 New Yorkers are currently in collections with medical debt. Whereas the New York Health Act, currently S3425A1466, would enact a single-payer healthcare system with high-quality, comprehensive health insurance for everyone who lives and works in New York. Whereas the New York Health Act would provide universal health coverage with no limitations to selection of healthcare providers. And whereas the New York Health Act covers all medically necessary treatments, including medical services, prescriptions, vision, dental, hearing, long-term care and support services, mental health and substance abuse treatment, and reproductive care. Whereas the New York Health Act is estimated to save upwards of $45 billion for New Yorkers by eliminating current administrative costs, closing reimbursement gaps, and providing lower cost healthcare coverage for 90% of residents. Whereas the New York Health Act would eliminate all individual financial burdens associated with healthcare for New Yorkers, including premiums, deductibles, co-pays, and prescription drug costs. Whereas the New York Health Act would provide resources to keep New York State hospitals open. Whereas the New York Health Act would be paid for through taxation of those who have financially succeeded due to our state's vast public resources. And whereas the New York Health Act has support from a majority of state legislatures in both chambers, with 33 senators and 74 assembly members signed on as co-sponsors. Therefore, be it resolved that Manhattan Community Board Committee calls on the New York State Legislature to swiftly pass the New York Health Act, currently S3425A1466, and calls on the New York State Governor to immediately sign the New York Health Act into law upon passage by the legislature.
Yes,
Should we make it long?
You should review the fine those insurance.
I have a question.
Yeah.
Is the tax taken out of? So let me see if I can understand a little better. I pay a lot in health insurance for me and my children, monthly, almost $600 to $700. Exactly, and we're about to get hit with more, right? And then you're saying that it's taking more.
No, the idea would be you wouldn't be paying for outside insurance any longer. it would be coming out as like. You know, all the FICA stuff you see, you know, for the federals,
What insurance companies are, what doctors would accept this? What, like, because in order for doctors to, you know, they have to be under a certain amount, or would this affect the doctors that you're seeing if they don't accept this insurance?
This would not, and because would be statewide and it would replace private insurance. It will actually increase access, so you won't. As an individual, we will not be paying for insurance, this is sort of an equivalent to Medicare for the entire population. So it will be handled administratively through tax revenue, through other revenues, through federal money that's already given to the state, and which we can expect to continue to see some of it, would be what finances this. It would take the cost away from individuals and families.
And what about medication?
It would cover all medications without.
Generics or anything? I mean, there's a lot, like, I feel like there's a lot of holes down. I'm
Well-
nervous right now. There's a lot that's, you know, health insurance is very complex. I worked in the medical field for years, and I had to, even to get anything approved, it would be, try this first, try this first, try this first, and this is a process of, if the doctor doesn't take it itself, then my, even to apply to get let's say, Health First wants to come to my unit. It takes like 6, 7, almost 8 months for a doctor to even get approved to get Medicaid or Medicare, even more, Medicaid and Medicare is even more. But like Health First, that's why some doctors don't take it, or they even make it difficult for doctors, so it's like, are you guys gonna take the responsibilities of doing that and working with doctors, or this has to be a partnership with doctors that are that are saying, yes, I'm gonna work with this people, and yes, I'm gonna be under this, because it sounds like you see $11.99. I used to have $11.99, my husband used to work in NYU, he still does, but he's no longer there. $11.99 is a union that pays, you know, like pays their insurance or whatever, but at that too, they use a specific insurance. Like right now, my kids used to have Empire Blue Cross Blue Shield, but NYU just transferred. So now NYU is under United Healthcare for the first year. So it's like it sounds.
So I think that's the whole purpose of the New York State Health Act, is to have one unified payer and one unified rate for the state. It would not be in the interests of any medical provider, from the big university medical centers to individuals in private practice, to not be members.
Are you gonna have? Do you think you're gonna have a fight with all health insurances that are now and doctors that are under other health insurances? Maybe this is
No, because I think what this will do is disappear the private health insurance companies from New York State. So it also puts a lot of power in the hands of the state, and the medical centers now they'll negotiate with United Healthcare, and then if they don't like what they're getting from United Healthcare, they'll cut them off, and they'll negotiate with Blue Cross Blue Shield for Aetna or whatever other company is involved. Because this is a program that will be administered by the New York State Department of Health, there isn't the opportunity, there won't be the competition, and it will be a unified system of both payment and payment rates. It will be a much less complicated system.
If you look at how, let's say, how is this one insurance and this one thing is gonna cover everything that I need? And
Can I interject? Okay, let me,
it's just like.
it's like
Medicare for.
Yeah.
most of you look younger than us in Saul, which is senior African leadership team.
Okay.
So- So if you happen to be on Medicare, at least in New York City, it's no problem going to high quality places like NYU, like not at all, because wait, let me finish.
My mom is 78. Okay, Robin, let's just one at a time. I just wanted to tell her that about NYU. NYU no longer takes Health First. So my mom has.
Wait,
Medicaid,
they don't,
Medicare,
I'm sorry, they no longer take what?
Health First.
but that's not Medicare.
That's right.
What I'm saying,
But I'm saying, my mom has Medicaid, Medicare, and because she has Health First, and why you cannot.
but help, here.
Okay, let's go.
Let me just, give me a second, a couple seconds. Is that Medicare has also all this Medicare Advantage plan and stuff like that. That's problematic too.
It's terrible.
So, right, and so the first thing I'm gonna say is, people say, I don't wanna give up my insurance. Who here likes their insurance?
I like
Okay,
the one that's
so
being taken away from me.
we can acknowledge that the insurance plans that we get are not good. So when we're talking about problems of current insurance now, that's what we're talking about too. There's problems with current insurance. And lots of times with your mom not being able to get coverage, that's because the private insurance that's adding on to the Medicare are cutting corners. They have participate PPOs or whatever, they have networks, you can't go out of network. But if this insurer is, if the New York Health Act is the only insurer in the state with 21 million people or whatever, that's a lot of economic power it has. And it's also the only game. So that it's written, the bill is written so that all those things are covered. I mean, I don't know how many people have a good dental plan. I don't know how many people have good hearing aid plans. And again, these are all things that when you get to our age, we know about hearing aids and stuff like that. I mean, they're expensive. Unless you're lucky with, so I'm just saying that all these individual plans, if you look at Medicare now, they have Medicare Part A, B, C, D, E, F, it's like nuts. We don't have to do that. So I understand your concern. What I'm saying is that this is set up to get rid of all those divisions and just say mental health, physical medical health, all those things that, teeth are important to physical health. Why it's a separate insurance, I don't know. It's just put it all together, simplify everything and pay. So I'm not saying your mom doesn't have challenge. I'm just saying that we're trying to get rid of that. Let the chair.
Okay, no, so, do you have more to answer her question, or just not, then we'll go on to the other question?
Yeah, just a quick answer to your question. Part of the problem that your mom is facing is that she probably has for Medicaid and Medicare both rolled into Health First, which is a private insurance company. There would be no private insurance companies. There would just be the state covering everything.
Oh, okay.
And because the state will be covering everything, as Bill said, it gives them tremendous financial power. For example, to negotiate with pharmaceutical companies, to negotiate with medical supply companies. So that costs will ultimately be low.
You're sure.
Okay, so Arnett.
No, that's first.
No, what's name?
Oh, I'm sorry.
I want to thank you for coming. I didn't read, the actual act, I just did the clip notes just now. And with the single payer, I think some of the concern about it is a lot of, I don't want to say propaganda, but a lot of information that we hear, propaganda from insurance companies that would say, if we do this, it'll be extended wait times and it won't be as efficient. But I do know people that live in Canada or the UK have the single payer, but they also have the additional thing that would, if they wanted to pay extra for something that was maybe not considered or something cosmetic that may not have been covered, they also have that option. I think one of my concerns about this is I have Trump fatigue, and I'm concerned if this is a single payer. Like right now, we have reasonable persons in our state government. What would happen in the event that we have unreasonable people in our state government and then everything is centralized? So therefore they may say, from now on, everyone must eat red bubble gum, and this is what our new dental thing is, and just like, so in doing that, I'm wondering, because I haven't read the legislation, so I'm asking this question kind of ignorantly. Is the legislation also allowing deference to our doctors to have input in this insurance as a single payer? And also, are there opportunities if, let's say, for instance, I'm giving birth, you can't do it again, but just throwing that out there. If I'm giving birth and I decide I want to have a single occupancy room versus a hospital with other people, will I be able to say, I want to pay an additional $1,500 in order to have, privacy? Would that also be part of what the single payer will look like under this act?
I'll have to find the answer. No, I mean, these are good questions, and I haven't been at any possible forum to have about it, so I'm not even sure if they come up or not. I know there's no plan to have a private make like when they were first passing Obamacare, the private option versus public option. I'm not sure if they have a plan to that people can pay extra for first class. I don't, but I don't mean. I will say again, with Medicare, I had a pretty serious operation 2 years ago, and I had a single room in NYU Langone it was like a postcard view of Long Island City at night. I posted it on Facebook, and I was, what are you in the hospital for? I said, no, that's not the point. The point is my view. I will say about the waiting list is if I know even with Langone, and I don't know about anyone else. Right now, you try to get a doctor if you're a brand new patient. It's still waiting a couple months.
No, we can go to.
Thank you.
I missed that part. So, the waiting list is a concern, that's at least right now for even our current system.
So just to comment about, if we get Trump like here. Great Britain had Margaret Thatcher, and it didn't just disturb their holy grail there. I don't think for a minute, I don't think it's realistic to think that we're actually going to get rid of a private option, which doesn't mean we shouldn't advocate for single payer. I do want to say that many doctors absolutely hate the insurance. They hate it. Some doctors, the very rich ones, have stopped taking insurance, or they offer their own insurance, like you pay me a certain amount a year and I'll take care of you. I think a lot of doctors, I have a doctor in the family, so just know a surprising amount of them are for single payer, so that they can concentrate just on medical issues and not have to deal with this kind of stuff. I just want to say that those advantage plans are terrible. They're just absolutely terrible. And having, like right now, I have the best insurance that's being taken away. So I just had surgery exactly 5 weeks ago. The doctor and I are spending hours and hours with the insurance company because they don't want to pay for the last day. Wow. It's what we have now is not for our benefit.
Anything else? Okay, Rhonda.
Thank you guys for coming, and I'm generally along with everything you guys are saying. I personally haven't had enough time to read through the materials that they sent. Like, do we have to vote on this today?
Well, we are going to vote on it today. So we did get a presentation. I did give you some materials. I think this is like if it passes, it's like it would be like a major change in our health system. And there's always stuff about implementation, which you are asking about, you're asking about, that probably, it always needs to still be figured out. And it'll be a long-term process. So they're just asking, I think the way we should look at it is like, in principle, do we support this idea of a single payer system? And then look at the reso and the different whereas, and then the reasons why we should. That's the, I would say that would be.
I could also just add, we attach information, if you go on the website, and look at the agenda, we attach information. So I've had like the law, we got the law, it's been on for a while, and we now have additional. So you can always ahead of time get, and I realize you didn't know, just for the future.
Yeah, so on the agenda, I emailed out the, well, people get it from Edwin, in the beginning, and then, I email out the agenda, and I copy and paste it from the website. So the link is also on the email, and it's just basically, I think it's a link to the bill, or to the bill, whatever it is, on the state assembly website. And then in addition, there were your two fact sheets, which I sent later after I got it from her and sent it to them. So, the bill is the bill, and like you said, the bill's been around a long time.
Yeah.
It's actually not new at all. Oh, yeah, so we can vote, so you, that should be, so the vote is yes, no, or abstain. And I'm sure no one is present but not voting, that's if you have a conflict of interest, like you work for somebody. But we don't have that situation here.
Okay. May we?
Yes.
Larry Finn, yes. Eric Diaz.
Yes.
Katie Shields, absent, May, absent. Rami Rao.
Yes.
Anna Kafar.
Abstain.
Robin Oliveros.
Yes.
Andrani Rivera.
Yes.
Arnett Scott.
Yes.
Carmen Perez.
Yes.
Okay, great, so it passes, so the next thing is that it will, be on the vote sheet at the full board, which is
25th, I think.
November 25, before I said October 28th, although it's not.
Yeah.
Yeah, so it's November 25.
So some of us will be there.
Oh,
For
yeah.
that, just for the full board.
You can speak for 2 minutes in public session, if you want to speak about this.
And if we have any concerns, you guys are open to.
Yeah, well, I'm just saying, why if the full board one has questions?
I
don't know, I don't know the process.
That generally doesn't,
Okay,
generally, the questions go to the committee.
or you guys do it.
So it's more like people go there to just to, make an extra plug and remind the full board that, this agenda item is coming off the board to the agenda. But, it's just an extra plug. So it's 2 minutes and you can get there a little early to sign up.
You have to sign up by 6:30,
Right.
that is PS 20.
Okay.
Thank you all.
Thank you.
Thank you. Thank you.
Yeah, give me my back.
Okay, so we are now on tab and C report. Okay, I can update you. Oh, you're updating us on C, souvenir, souvenir tab, okay.
Souvenir cab, they have 295 beds, there's 288 tables.
Okay, well, let's wait till everyone settles down.
Oh, we're here.
I think we're good. Okay, well, okay. So,
Excuse me, where you wanna take it now?
Oh, I'm good. Sorry.
Souvenir Hospital has 295 beds for seniors, and they have 288 right now. New York City COVID vaccine, they requested it, but they haven't gotten it yet for COVID. They do have flu shots for all patients for right now. They're waiting for the flu shot. Souvenir annual 140th event happened. They've been open for 140 years and they celebrated it really nice. And health insurance, they're gonna have a health insurance workshop on November 13th. I will send that over to you. It's a flyer so that people can sign up and learn more about what's changing, what's coming new, and insurance workshop.
295 beds that you need for the skilled nursing facility?
Yes, for the nursing facility, they have 295 and 288 are full right now. So they are like at full capacity. We're gonna get I requested a tour, because I've never seen this, so I envisioned something in my head that I haven't seen, so I asked for a tour, so I'll let you know if, when they're gonna give the tour, so that you guys can join.
Okay, that's good.
Yeah, because I wanna see what it is, it's just, I don't know how it looks like, so she's like, you haven't seen them, like, no, so when I get that invitation, I will forward it over to the council, and you guys can, we can see, and they did get voted the most efficient or most beautifully run nursing home, they came number 2 in the city of New York. Or the state, they came after the team, so that was a big, celebration.
Okay, since we are on hospitals, Eric, did the Presbyterian have a meeting?
Yeah, maybe. After waiting so long, I got sick that day. I'm so upset. Once they send out minutes, yeah, it's like, yeah. Can't write this up, but. Yes. You know, thank you.
Thank you, Eric. I think that's it for the tabs. We're not on any other tabs, but Susan, did you have a report about hospital tab?
Not a hospital cab, a shelter cab.
Okay, shelter tab.
But I just wanted to say, people are jumping ship, so we lost our liaison from, DHS, who is the person I work with for all the cabs. So I doubt if we'll have any more this year. I can try with some of the shelters, just dealing directly with them. And, I don't know how long it'll take for the new administration to get set up in that, so. Some shelters I have contacts where I can do that. But like some of the hotels that we're just discovering or we're just beginning to have cabs, it doesn't look like we've had that for a while.
Okay, so, the next thing is, we went to a Lower East Side Community Cares meeting. I think. They mainly talk about food pantries, right? Pardon? So we went to so there's a coalition called Lower East Side Community Cares. And, we, now go to the meetings. They got started out of that event that Harvey Epstein did, it was an immigration related event, earlier this year, and there's this coalition that, organized the event, but they have continued. So they have these, monthly meetings. They're the ones who had the bystander training. That was, at Middle Church. And I saw, one of the other CB3 members there, but, it was a good training. And then more recently, they had a meeting, and I actually missed half of it. So, but Susan was there for the whole thing.
It was so many meetings. I think I've been to 4 this week on just those issues, and so it's hard to separate them all. But I did want to bring this to this group and to the board in general. Because I was at one last night also with Eric. And there is a there's one thing I was surprised to find out. And this is mainly about food for people that are losing SNAP benefits. There is plenty of food. All the nonprofits can get enough food. The issues are, they have transportation issues and they have refrigeration issues. So those are things they can concretely work on. What they need is volunteers. There's a tremendous need for volunteers. And I was talking to some people. I'm going to have Laura Siegel from the East Village Community Coalition come to the full board here in public session and talk about volunteer needs for the refrigerated community refrigerators. And I think would also be good maybe to work with Eric and Brad and Katrina, who works with the CEC, to try and put together opportunities to offer the board and see who can, volunteer. If it's one time or once a week, it's difficult for people on the board because a lot of this is during the day. But I would, many board members have often said, what can I do? And right now there's a tremendous, tremendous need. So I'd like to work with anyone who can to put that together to offer people.
Okay, so the other thing is, we had a meeting with, the chancellor, the school's chancellor, about the subject of the meeting was the school at its crossings. So it was, me, Susan, and Andrea, So Andrea, she met the chancellor, I think at some event, and approached her about having, talked to her about the school at Essex Crossing. I mean, it is something that's, mainly more authorized by the SEC, the school construction authority, but they, with the chancellor, we felt the chancellor needed to make aware of our needs, and they were actually had people at the meeting. So it was a Zoom meeting. We, the chancellor was there, different people from the school construction authority was there. We presented our arguments, which is that, our schools are very old, we're, in underserved area poor, and so there is kind of these like equity issues. And yeah, they just listened to us.
Well,
They
they also kind of said no.
Yeah, they kind of said, they actually said no, they just listened and they said no.
Well, yeah, I mean, they said there's schools older, there's schools that are overcrowded. That was basically that they countered our arguments. They also said, and this is kind of really irritating. So the city, we have a site at 22 Suffolk Street that for 5 years, when Essex Crossing was developed, was put aside for a school. That 5 years is up now. But what we have now found is that the city, put this out for us. What we now found is it doesn't even meet the criteria of size needed for a school. It's, so, all this time we were being offered a site that was not adequate.
Wow. No,
Yes.
PS 110, right now, this moment, the reason why they have a staff meeting for so long, because you're not supposed to have it for that long, but PS 110 is falling apart. The building is falling apart.
We have schools over 100 years old.
That's
I've got
what
the
we're-
presentation.
Yeah.
They are older than the average school district, but there are other school districts that are old. The one thing we don't have is we actually are losing children under 18 every year. So we do not have overcrowded, particularly in Queens, you have really overcrowded schools. We gave them the IDO presentation, May fixed it up and, and we showed them the facts and the figures, we showed them the lists. And, we're not in the worst shape. What they did say is that they will meet with us and look at our issues, and the 188 should certainly be one. And they will look at what needs to be done to fix our issues. And to us, it might seem like a waste of time to put money into schools 100 years old. But if we can get them to do that as opposed to doing nothing, we should get that.
What if we want a different kind of school here? Would they be,
They're
you
not
guys,
open.
well, not them, because, I think, Literacy Academy, I would like that school down here, but I don't think it has anything to do with them. That would be in a, it's a school with Naomi Pena, and it's a school for kids with reading disabilities, and dyslexia and all that. And, they have it in the Bronx, and there's another one in Brooklyn. That would be amazing for us to have one down here, if we was to have that space for that. It's something we can have.
So Robin, the issue is not just a new school, because sometimes when they talk about a new school, it's in an existing building. So we're talking about building a new structure.
No, but what I'm saying is her school does not fall under DOE, her funding is private funding.
Oh,
Is it charter school?
It's not, it's like only funding for their school, I don't know how that really works, but I know that she is the one that comes into school, or they built, I think the one in Brooklyn is new, I'm not sure. But would they be willing to build a new?
If it's different money, it's not school, so we're talking. School construction is not going to spend the money on a building here. If you're saying it's privately funded, that's not school construction. So we need to find out, who is that private funder?
Yeah, there is no private funder right now.
I
I mean, no, there has been talk about in our committee, or at one point, I remembered maybe on the board, but having like school construction authority pay for some and our private funders or like the construction costs are public, private, but we never really, like, you know, I mean, we never researched like who or found who the private funder would be. And I don't even know the school construction authority would pay for half of it, like, they don't want it at all.
Yeah.
You know, I mean, so we tried to tell them, well, isn't it cheaper to, build a new school than try to keep fixing the old one, you know, so they said, oh, well, just tell us which schools have the problems and we'll go look at it and fix it.
Yeah.
Okay, Arnett.
Couple of things, well, one being, if I'm hoping I'm, not hoping, but I heard that they're saying that the space that was set aside isn't even adequate enough to build a school, so even, yeah, so even if there was privately funding, it still has to go through the, whatever guidelines are set aside in order to actually build the school. So the space is, if the space that they offered was basically just to say a space, but not adequate for schools, and there's really not much we can do in adding something that they're gonna already say
No.
it's not sound, it's not a space to have. And then secondly, we went through walkthroughs over and over and over again, in which the schools, SCA went through the schools and said the amount of money it would cost to retrofit these buildings exceeds the amount of money that we are willing to have. And not only that, if we even did it, the building's not structurally sound to do so. So I've gone through the motions of actually going there and trying to do stuff, and they have managed to do certain things, but a building falling is not something that they really would invest in, and it's just sad that they offered something that really wasn't meant for us.
We did suggest demolishing, that it would be cheaper to demolish, and rebuild, and that there would be enough space to move students around in the meantime. You know, there's logical and, reasonable ways to do it. They're not interested in building here.
You can use that space for something that will benefit the community.
It's not our space. It belongs, right now, it belongs to HPD. There are discussions about housing there, which are very sensitive, and I don't wanna discuss here, that deal with Habitat Humanity, not. So, let's not get into that. That doesn't mean that it couldn't be affordable housing, but that's a whole different, thing.
And you can put like something, can you put community board, or something like that we all in the community can take advantage of, because they have all the Essex Crossing completely.
Like I said, it belongs to HPD. Right now, it's still under their jurisdiction. But I'm gonna say it's a whole different committee, to be honest. It's, it's a land use issue.
Right.
Which we were trying to make it a school land use issue and have not been successful.
Yeah, so it's like, this is a community wide issue and it's, there's a little bit of land use, but, but this, and then there's this whole other complication.
One question, if a new bill is passed about skipping the ULURP.
Oh,
Not a bill.
No, they don't, they do not need a ULURP. They would not need a ULURP if they built housing there.
Yeah.
I've already checked this with DDC, who also is involved, because they were involved in the.
So basically they can do whatever they want.
Yeah.
They just gave us, oh my God, we got that thing, okay, it's quiet, right?
I don't know that, but again, that's, I do know to build housing there, they do not need a ULURP. Other than that, that's to be investigated.
Okay, so are there any other, I don't think there are any other tab or CEC reports, so I need to keep checking. Okay, Okay, so just about, okay, one more thing. I sent an email out about this, about future agenda items. So in December, we're going to have the, New York Public Defenders to come. And it seems like there's,
we tell them what we want them to present on.
oh, so, yeah, I will tell you. So it's about the treatment courts, and I'll give you a couple of questions that they should cover.
Okay, so you'll email.
Yes, I'll email, I just haven't done it yet. And then I asked about, yeah, I'm also gonna try to have, a couple of, a speaker to come talk about, New York State, legislation about, immigration. I mentioned it at full board, I put it in my email. It's about, legislation one is access to representation in immigration court. And the other one is, it's called New York for All, and it's about, stronger, protections against, the state and local governments from colluding with federal enforcement authorities, colluding and sharing resources and information with them. So we have sanctuary city laws, but this will be stronger statewide laws, and something they've been trying to pass for a long time, the advocates. But they're like, oh, now we have to really try again, we have to, so, it's coming up again. Yes.
What about the Kansas Health Center? They're looking for a spot.
Okay, so wait, let me get back to, let me finish my third thing. So, no, I'm sorry, okay, so that's safe, I don't want to. Okay, Robin, please. So the third thing I asked you about was the, whether or not you want you want informational presentation about the John Jay, study on bail reform and how it has affected citizens. Or they say it has actually, it's had a positive effect.
It's really specific, is it?
Huh? Yeah, but I wasn't, it's an email, and, so are you interested in that presentation? No?
Yeah.
Definitely, okay. All right,
So there's 3 items then.
yeah, okay, good. Okay, now what did you say?
No, I was saying, what about the Kansas Health Center? They're looking for relocation. They have the ability and money to build all these areas.
I'm sorry, I didn't hear.
The Kansas Health Center is looking for a space to build new because they're getting kicked out of there.
Yeah.
And then the CEO said, what?
Yeah, I don't want, to build. So that was an interesting thing. If Essex Crossing space could be there, that's an interesting thought, I don't know.
I don't know, they, like I say, they have to go to the city. Yeah, they have to work with, city planning and HPD.
The building is owned by HPD, she says.
It's owned right now by HPD.
Uh-huh.
They have experts, and they should have, they know how to,
No, yeah, I was just thinking, maybe Eric can flag it to her so she can.
What?
Maybe Eric can flag it to the CEO and she can go on her own and invite
Sure,
her.
absolutely. But there is, well. The council member does have plans for housing.
Oh.
But my thing is with the council member, like, I love him to death, this is what my fight with him is NYCHA, right? Baruch has so many vacant apartments, Velaris have so many vacant apartments, Smith too, like thousands of apartments that are just sitting there waiting for their process that takes over a year.
It's called the Vacant Readiness Program, and it's in our budget priorities. It takes over a year. They improved it last year by maybe a month or so. It was, land use committee actually made that part of their,
It takes so long.
part of the priority. But again, it's,
Yeah, it's not, it's just another thing, it's not.
Vacant Readiness Program is what it's called. Yeah, it's
So-
in our budget priorities.
Okay, so, are we ready to end the meeting?
What is the timeline?
Oh, the timeline. Oh, yeah, okay.
Should put that on the screen.
No, it's on our agenda. Okay, it's under, planning for term limits. So I emailed it to everyone. It was part of my first email, it was an attachment to the first email.
What was that on this memo? So I wanna ask you, May, I thought it was so impressive, can I send that to all the other committees to use for model?
Yeah, sure. Yeah, it's helpful to them, sure.
I'm serious.
You did a good job. That's all, I'll just, tell people who have seen it in an email, but he's gonna show it. It was. All right, so this is this is an annual timeline of, what we do.
Oh.
Okay, so it's.
I've seen it.
You see it?
I told myself out loud that I needed to do that.
Okay, so, I just went through like all my notes and emails that I like, save. And so this is what we do every year. A lot of it you'll see revolves around, district needs and budget priorities. So it starts in April, when we do a first review. So the calendar totally revolves around, district needs and budget priorities, because it's important, it's, something that we are required to do, and that's why it's in the calendar. In this calendar, it starts in April and it goes to October. So we always, and it takes several months. So in April, we do a first review. It's usually called first review. No, actually, May is the first review. So, we get new members every year, and then we do this once a year, so we always forget. So that's why in April, the first thing we do is we just review what a district needs statement is, what the budget priorities are, and then we look at the timeline. And often if you work for a nonprofit, you're used to a different timeline, where you go out to like city hall or city council meetings in the springtime, starting in February at the earliest, and you start advocating for the budget. But we are coming in earlier. So this is for like, for this year, it's for the, next year's fiscal year. And then in May is when we do the first review, and that's when all the committees also do the first review. They usually, so what we do is look at last year's district needs, and we just kind of brainstorm a bit, what needs to be changed, what we need to add, what we want to know more. And then in June, we continue discussing, and finalizing. And then also in June is when, the district managers, all the district managers in Manhattan, the 12 community board, they all meet together and start preparing for the budget meetings that they will have with OMB. So they meet together in one meeting, that was OMB. So back in the day when we were in person, it literally was like on one day, or maybe 2 days, where
It was one full day.
one full day, with people like sat in this big conference room at OMB, and all the agencies came in and did their thing. The next agency came in and just sat there and all day with lunch. A lot of food. And so, but now it's broken up. So, during COVID, they did it on Zoom, and it's been on Zoom ever since, where it's like spread over different days. So we call it meetings, but it's really that one big meeting that takes place over several days. And, that's when district managers, they prepare an agenda for each agency. And that's why Susan always asks us, well, what questions do you have about the budget? So this is our chance, that's our time to tell Susan what our questions are, so that she can have that information to work with, be part of those meetings to plan the agenda. So July, we continue with the district needs, June and July, we continue. July is when we review the first, the real first draft, and we don't meet in August. In September, we can, discuss some more and review a final draft. So it's pretty final, and then, in October is when we vote. So in December, we shouldn't be like,
When it's correct, that I'm gonna be finalizing the district needs in July.
Oh,
And we always finalize it, in July, we don't need in August, and then in September, we start looking at, budget.
Oh, okay.
And if there's like a few things or a few statistics to be plugged in, we can do that last minute, but it should be finalized in July.
And in September is just review budget priorities.
Yeah, in September is budget priorities, in October we vote. On the district meeting and budget priorities.
Okay. Yeah, we were putting this together. Huh? Thank you for putting this together. Well, it's. I'm term limited, so I was only on for not that long. So a lot of chairs are, I don't know if every chair is term limited, but.
I know Parks is, Clint is not,
Yeah, so I'm one.
Vinny is not.
Okay. Well, yeah, so, this is. Yeah. And so then the other thing is we do this panel event. And, the panel event is, it's actually to inform the district needs. The last 2 years we've done it in June, but it doesn't have to be done in June, so you'll see in the past, we've done it actually more in the winter time, in December, March or whatever. So I didn't put it into the calendar, because we may decide we wanna do it, another time, but there's 4 months of planning involved. And since we meet monthly, the decisions are made at the meeting, but a lot of work can be done in between meetings. So the first month is just to, brainstorm about themes and subtopics. The second one is the continued planning, and then in the third month, we should finalize everything, and the fourth month, we actually do it. So the panel discussion, this panel event occurs during a meeting time. It doesn't have to occur during a meeting time, I mean, we all gotta go to another meeting. But since we're there anyway, we, take advantage of it, and also what I didn't mention here, but you may have realized is we have a nice flyer, we publicize it a bit, so it's a bit more like an event that people go to, it's not a regular meeting. And here we have had members of the public come, and we've had different topics over the years. So. Yeah, that's just the two main things, and so the third thing was about the survey. So this is also to, get information about the community, a lot of it is for the district needs. So there's different ways we can get information, we can do the panel, we can, we have invited them as, if you can come to some of our meetings to talk. And then we can also do the survey. Not everybody comes to our meeting to talk, but they can do the survey. So you see the survey is short, it's 5 questions. I know that for those of you who research surveys and don't reply, like me, you want a short survey, right? Yes.
Yes.
Yes, okay, yeah, so straight to the point, and even then, you still have to follow up, right? Yeah, Eric is nodding, yes. So these are, there's 4 questions here, and last year we added a question specifically about the new refugees and migrants. So we can customize a question according to that service provider, but also maybe one question that's for all, maybe it's according to something that happened that year. So since the last year, we've seen a lot of what's the immigrants, refugees and migrants added that in. We added that, so that's, so the purpose of this is like to give us a little, handbook and, things that, get the committee going and you can add more. Are there any questions or? And we can continue to think about, we don't have to talk about it, like, we can talk about this at other meetings if we have more. I will. Okay, great.
Fantastic.
Okay.
I'm looking forward to.
All right, so now we're ready to adjourn. Oh.
Okay.
Do we approve of the minutes? Yes. Yes, are there any changes to the minutes?
No.
Okay, the minutes are approved.
Okay. Haley,
Yes.
Mary Fenn, yes, Eric, yes.
Oh, yeah. Yes.
Keisha Taylor, absent. Tommy Morale,
Yes.
Anna Catar,
Yes.
Robin Oliveris,
Yeah.
and Johnny Rivera.
Yes.
Renee Scott,
Yes.
Carmen Perez.
Yes.
What's it look like?
White.
Why are you?
I